So in Suffolk and North East Essex integrated care system, we have a population health management strategy that brings us all together with a shared vision of what we're trying to achieve.
We worked with Optum to create a linked data set. We started doing some work within the communities using that data to design some targeted interventions to work with particular groups of people.
What we're really talking about is building that full pathway of a patient through all of the different stages where data is collected.
Because it's linked and because it's at person level, you can really look at where the inequalities are. You wouldn't see those differences if you were looking at larger numbers.
In terms of strategic commissioning, we've got a responsibility to make sure that we're addressing those wider determinants of health. Those linked data sets are crucial in bringing together the social side of things, but also the health data as well.
The data is rich. It really helps us understand what the problems are in our area. It helps us identify people who've got long-term conditions who aren't particularly well controlled. We can then be a bit more proactive in searching for those patients and then actively managing them.
From the people perspective, we've developed in SNE an intelligence function. We can work really collaboratively and come up with some really excellent bits of work.
The idea of an intelligence function is that it's using, again, a lot of the population data that we work on with Optum to say who are these particular groups of people who we could intervene. Through the intelligence function, we've been able to start doing some of those next step analytics work and statistical work, which has been really exciting.
We use population health management data to support the Joint Strategic Needs Assessment. So that's a statutory function that we have in local authorities. It's about understanding the current and future health and wellbeing needs of our local population.
Risk stratification is built into our clinical system, so we can run searches, we can look for patients who we need to be targeting. Then I can say to that patient, look, this is where you are now, this is where you need to be in the future, and if you get to this point, your risk of developing a heart attack will reduce by 20%. Providing that information for patients does empower the patient to make some healthy life choices.
Suffolk County Council's mental health lead was able to give us support on identifying the risk factors for suicide and depression in men. Through that, we were able to identify 20 risk factors and put them into 4 domains: physical and mental health illness, substance misuse, social isolation and loneliness, as well as financial adversity. That allowed us to create a heat map of where risk was highest. It's using our data and able to look at where they need us most.
We've developed our own segmentation model, using that to kind of drive this left shift.
That's the idea with the left shift, is that actually the more we do in primary care, the less they'll be in secondary care, but we haven't seen that full shift yet. And to make it work, one of the key things is making sure the resource is shifting with it.
One of the really good things about this model is that by understanding different groups with different healthcare needs, it allows us to better prioritise those individuals by providing targeted care for them.
So around about the last 12 to 15 months, we've been implementing PHM a lot more, and it's not only allowed us to be a lot more focused with our visits, but also evidence and evaluate the impact it's having, the type of services we're having on board, and the feedback from the communities themselves.
We can see that PHM is influencing such a broad spectrum of work across different organisations, but also across different healthcare professions as well.
We share conversations with people all the time around, well, does this data sound right to you? And because so many people are part of the conversation, actually, we are in a very good place of almost having a single vision around what the data's telling us. We're all on the same page, pretty much, which is also really helpful. We can just bring it all together and we will make a shift in health outcomes for the better for our communities.